Engage is a patient arrival system designed to allow your patients to check in for their appointments automatically. This can help with queues at your reception desk, staff shortages, and frees up your receptionist's time to concentrate on other work. As you can see, the touchscreen is a self-contained standalone unit. The unit is very robust, featuring a 19-inch LCD display within a tough stainless steel case. Here you see our wall-mounted version. We also offer a desktop version. We use capacitive touchscreen glass, which means you can use the touchscreen with gloves on also. The large high brightness screen and large buttons make the screen very simple to use for all, as we will demonstrate for you now. So patients arriving at the surgery for an appointment can go immediately to the screen rather than join the queue at reception. First, the patient will be asked to select their gender, then their date of birth. There are a few different methods of selecting date of birth, and it is up to the practice which they prefer to use. Here you will see that we are asked to select the month in which we were born, followed by the day on which we were born. The system will then conduct a search of your appointment system, looking for any patient matching the credentials chosen within a pre-configured time window. If a unique match is found, the patient is asked to confirm their name. An optional discrete style is available if you wish to make the font seen on this page smaller. The patient touches the Yes button. Once confirmed, for some clinical systems we have an optional feature that allows you to collect QOF data, such as the smoking status of a patient if it has not been recorded within the last 12 months. The screen will then confirm that the patient has been successfully checked in with the appropriate clinician. If your practice has more than one waiting area, you can configure the touchscreen to direct the patient to the appropriate waiting area, as you can see here. The patient can clear their details immediately by touching the Finish button. The screen returns to the welcome page ready for the next patient to check in. As soon as the patient has successfully checked in, they will be marked as arrived on your appointment system, ready for your clinician to call them in the usual way. If necessary, the patient can select an alternative language by touching the flag representing their country. The touchscreen will then automatically display each instruction in the chosen language. So what happens if there is more than one patient matching the gender and date of birth selected with an appointment? No problem. The touchscreen will simply keep asking questions until it finds a unique match. So it will go on to ask the patient to start inputting their surname. As soon as it finds the match, it will present the patient with the confirmation page. In the event that the touchscreen cannot find a matching patient, perhaps the patient has the wrong appointment time, it will simply advise them to go to reception. The touchscreen has many useful features which can be easily configured by your receptionist as and when necessary. For example, they can add an optional global arrival message to be displayed to all patients using the screen. You can also add a message per clinician too if necessary. This is ideal for warning patients, for example, that a doctor is running behind, or perhaps they have a student sitting with them for the day. The way in which your clinicians' names are displayed on the touchscreen can easily be altered to be exactly as you wish. So perhaps some clinicians prefer to be referred to by their forename only. For full information on all the latest features and prices, please visit our website at www.wiggly-amps.com.